He comes from Fairfield County, and he has been fighting the scourge of prescription drugs and been involved in rehab. Folks, you don't know what hell is till one of your members of your family gets hooked on these drugs. And it happens a lot in Appalachia and poor areas, but it happens all over this state. I picked Orman because he's a rehab guy. He still has hope for people who people have given up hope on. And the number of people that we find in our prisons, the number of people that we find on our Medicaid rolls, staggering when you think about the issue of addiction and prescription drugs. Orman has led the fight to drive the devil out of Scioto County. Think about this, folks. 10.8 million opiate prescriptions to 78,000 people. What are we doing about it, Orman?
Governor, you just stole my statistics. And by the way, there are state senators now calling me Orton Hall. I want you to know. We are making important progress on this issue. There are several pieces. And by the way, let me step back. The statistics that you quoted are really staggering. Back in my home county of Fairfield County, in 1999, we were able to identify 4 people addicted to prescription opiates or heroin. 4 people. You flash forward to 2010, the spring of 2010, 70% of the people in treatment at the Recovery Center for Addiction Disorders, 70% were there because they were addicted to prescription opiates or heroin, and they were turning away 200 people per month. It's really pretty unbelievable. If you look at our jails in Fairfield County, back in 2003, we were spending $350,000 incarcerating people that had opiate addiction. By 2008, 52% of all of our jail days were consumed by people who were opiate addicted, and it was costing us $2.5 million. 90% of those people who were in jail for opiate addiction were repeat offenders, and they had been there 5 previous times. We're putting the same people in jail over and over and over again. So back to your question, what are we doing? There are several major, several really important initiatives underway. First, with House Bill 93, we're giving the Pharmacy Board and the Medical Board the tools that they need to close the pain clinics in Scioto County that are there for no other reason than to feed people's desperate addictions. That's number one. Number two, with your executive order, we are able to purchase through ODADAS the medication-assisted treatment, the FDA-approved medication-assisted treatment that people desperately need to get better. And finally, we're going to organize an interagency task force that will coordinate the care, or that will coordinate the efforts across all of the state agencies. And this year will be the year that we turn the corner in opiate addiction in Ohio.
Let them know what we did with the ATOM boards, just so they can hear in a 48-hour period of time.
Well, and by the way, there's a story there too. Coming back from Scioto County, the governor is really concerned about the possibility that we're going to lose $33 million in RSC funding. So this was on a Monday, and the governor says, Orman, you call those ATOM boards and you tell them to elevate their money by Friday. And I started to tell him all the reasons why we couldn't do it by Friday, and he just looked at me and said, get it done. Now, we didn't get it done by Friday, but it is getting done. What's going to happen is that, and there are $33 million in Federal Rehabilitation Services Commission money that could lapse in the state of Ohio. It lapsed last year. But Kevin Miller, who, by the way, is also a very innovative administrator at RSC, approached our system, and what we're going to do is we're going to have local alcohol, drug, and mental health boards elevate money that they have to the state to cover services. And it's not just alcohol and drug services, it's also mental health services through ODMH. But they're going to elevate $8.9 million in match, and we're going to draw down $33 million to provide care for persons that have opiate addiction and other mental health disorders. It's really pretty remarkable.
We're going to meet with the governor of Kentucky, West Virginia, and a special thank you to our two great pals of mine, Bill Batchelder, the Ohio House Speaker. And I want to compliment the Democrats. They passed a bill to really get after all this by a unanimous vote. My great friend Tom Niehaus, the President of the Senate, and Armin, I want to thank you for that work, and Capri, I know over in the Senate, we'll get this done. We are united in this state to beat this scourge.